Hello, I'm a doctor with more than 30 years of experience taking care of patients over 50 here in the United States. Over the years, I've seen thousands of people living with diabetes. Some let the disease control them, but many others learned how to take control and still live joyful, healthy lives. Do you know what makes the difference? It's not complicated methods or strict routines. It's the small habits, repeated every single day. And today, I want to share with you those simple yet powerful habits, so you can see that even after 60, diabetes can be managed and you can still enjoy a full, peaceful life. Welcome to the channel. For many years I've been working side by side with people over 50 here in the US. If you're looking for health tips that are simple, practical and easy to follow, the kind of advice that helps you live happier and healthier after 60, then go ahead and hit that subscribe button right now. Because I believe each week you'll find here a small tip that could make a big difference in your health. You know, when people talk about diabetes, many immediately think about strict diets, giving up everything they enjoy and turning meals into something stressful. But the truth is, it's not about cutting out everything. It's about balance and timing. I remember one of my patients, Linda, 65 years old. She used to worry that just one piece of cake would send her blood sugar skyrocketing. Over time, I guided her to eat 3 regular meals a day, add more vegetables, whole grains, and lean protein instead of fatty meats. The result? She felt lighter, calmer, and no longer afraid to sit at the dinner table. Now, I want you to imagine this: a simple plate with steamed vegetables, a piece of grilled fish, and a few slices of fresh fruit. Simple, but your body will thank you for that choice. Science shows that eating slowly and chewing well helps your body absorb nutrients better and keeps blood sugar more stable. So next time you pick up that spoon, try counting 20 seconds before taking a bite of carbs. It's a small change, but you'll feel the difference. Have you ever finished a meal only to feel heavy and notice your sugar levels go up? I know you probably have. But if you give your body a chance by changing just a few small habits each day, meals can go back to being joyful, not something to fear. After 60, eating right isn't just about living longer. It's about living healthier, happier, and enjoying every moment with your family. My friend, do you usually sit down right after eating, turn on the TV, or scroll through your phone? I understand. Especially after 60, the body often feels tired. But let me suggest a small change. After each meal, stand up and take a slow walk for 10 to 15 minutes. It may sound simple, but the effect is powerful. One of my patients, Robert, 72 years old, told me he used to sit and watch his favorite show after dinner. His blood sugar would spike every evening. When I encouraged him to walk around the neighborhood with his wife after meals, within just a few weeks his blood sugar readings improved significantly. He even shared that he started sleeping better at night and felt more relaxed. Now picture this. You finish your meal, put on a light jacket and step outside. No rush, just calm, steady steps. The evening breeze cools your face. The golden sunset light falls across the street. Your body isn't just burning energy. It's sending positive signals to your heart, your digestion, and your mind. Medical studies confirm that light activity after meals stabilizes blood sugar, lowers the risk of heart complications, and helps with digestion. This isn't distant advice, it's proven truth. Have you ever felt heavy and sleepy after eating? A short walk could change that completely. After 60, every step isn't just exercise. It's your way of saying, I'm still in control of my health, and believe me, just those 10 or 15 minutes can leave your body lighter, your spiggy. My friend, I always tell my patients this: exercise is the free medicine that life gives us. After 60, the body gets tired more easily, muscles grow weaker, and balance isn't what it used to be. But trust me, if you stay active regularly, your health can change dramatically. One of my patients, Martha, 70 years old, used to be terrified of falling. Just stepping off a curb made her lose confidence. I encouraged her to walk gently every day and add a few balance exercises at home. After just a few months, she told me she could go shopping on her own and even take her grandchild to the park without that constant fear. Science confirms this too. Just 150 minutes of light exercise each week, like walking, slow cycling, or gentle stretching, is enough to make your heart stronger and keep your blood sugar steady. Add 2 sessions of strength training with light weights or resistance bands to keep your muscles, plus a few minutes of balance practice, like standing on one foot near a chair or practicing Tai Chi, and you'll protect your independence for years to come. I want you to imagine a cool morning. You step outside, each stride steady, each breath calm. That's not just movement. That's your way of saying to yourself, I'm still in control of my life. Have you ever felt your legs weaker or a bit unsteady when standing up quickly? If so, now is the time to start. And remember, you don't need a fancy gym or complicated routines. What you really need is consistency and the belief that every step you take is bringing you closer to a healthier, freer, and more peaceful life. My friend, I know many people after 60 complain that taking medication and checking blood sugar every day feels like too much, like it makes them feel sick. But I want you to see it differently. Your medicine and your glucose meter are not chains holding you back. They are tools that give you control over your health. One of my patients, Daniel, 66 years old, admitted that he often forgot to take his medication or reduce the dose on his own because he was afraid of side effects. The result? His blood sugar levels swung wildly, sometimes too high, other times so low he felt dizzy. When I sat down with him, I encouraged him to use a simple pill organizer and keep a small health journal. A few months later, he told me he felt more confident and his lab results looked much better. Imagine this. Each morning, you open a small pill box, take the exact dose your doctor prescribed, and then write down your glucose reading. Day after day, those numbers build a clear picture of your health. That picture helps your doctor know exactly how to adjust your care plan to protect you better. Have you ever felt confused when your sugar is high one day and low the next? The truth is, a single number doesn't mean much. What matters is the pattern, whether your levels are becoming more stable or more unpredictable. When you keep a regular log, you and your doctor can see the big picture and make safer, smarter decisions. So don't see medication or glucose checks as a burden. See them as small steps that let you keep enjoying the things you love, taking your grandchild for a walk, tending to your garden, or sharing a warm meal with family. And always remember, taking your medicine on time and checking your sugar regularly is your way of telling your body, I'm still taking care of you every single day. My friend, one of the biggest worries for people living with diabetes after 60 is those sudden drops in blood sugar. The shaky hands, the pounding heartbeat, the cold sweat, or that gnawing hunger that leaves you confused. I'm sure you've experienced it at least once. One of my patients, John, age 70, told me he once had a severe low blood sugar episode right in the supermarket. He was trembling so much he had to hold onto the shelves. Thankfully, he remembered my advice. He drank a small carton of orange juice, sat down to rest, and within minutes his body came back into balance. I want you to remember one very simple rule that can save you in these moments, the 15-15 rule. At the first sign of low blood sugar, take 15 grams of fast-acting sugar, maybe a small glass of juice, a spoonful of honey, or a few glucose tablets. Then wait 15 minutes and check again. If your sugar is still low, repeat it. And if you don't feel better, don't hesitate to call for medical help right away. Imagine you're walking in the park and suddenly feel weak, your heart racing. Instead of panicking, you calmly reach into your pocket for a piece of candy you've kept there. A few minutes later, you're steady on your feet again. That's the difference between being fearful and being prepared. Low blood sugar isn't always dangerous, but ignoring it or being unprepared can be. Keep a little sugar with you, let your loved ones know the warning signs, and most importantly, always listen to your body. That's how you turn diabetes from a fear into something you can manage, so you can keep living your life with peace and confidence. My friend, there's one thing many people overlook when living with diabetes after 60, their feet. Have you ever heard the saying, good health starts with your feet? For people with diabetes, that couldn't be more true. Even the smallest cut can turn into an infection, and sometimes a serious complication. I remember one of my patients, Susan, age 67. She liked to walk barefoot around the house, thinking it was comfortable. One day, she stepped on a tiny piece of wood. It didn't hurt much, so she ignored it. But within weeks, the wound got worse and she ended up in the hospital. Since then, she's never forgotten to care for her feet. I want you to picture this. Each night before bed, you sit down and gently check your feet. Is there a scratch, a blister, a toenail growing the wrong way? Just 2 minutes of attention can protect your steps. Always wear soft socks, well-fitting shoes, and never walk barefoot. And if you find calluses or nail problems, don't try to handle them yourself. Let a doctor or specialist take care of it. Science shows that daily foot care can dramatically lower the risk of ulcers and even amputations in people with diabetes. It sounds serious, but the truth is simple. A small habit done consistently can keep your feet strong and your steps steady. So treat foot care not just as health maintenance, but as a way to protect your freedom. Your feet let you take a walk in the park, visit friends, or hold your loved one's hand as you stroll slowly in the evening sun. Your feet are the foundation of your independence, and you can protect that foundation every day with just a few minutes of care and kindness toward yourself. My friend, there's a kind of medicine that doesn't need a prescription and doesn't cost a dime. Yet so many people forget about it, and that's sleep. After 60, I've had countless patients tell me they don't sleep deeply. They wake up in the middle of the night, or they feel tired every morning. And they often ask me, "Doctor, is there a pill that can make me fall asleep right away?" I usually smile and say, sometimes the best medicine doesn't come in a bottle. It comes from your habits. Picture this. A quiet evening, you turn off the TV a little earlier, pour yourself a warm cup of herbal tea, sit down, and read a few gentle pages of a book. Your body relaxes, your eyes grow heavier, and your mind knows. It's time to rest. Science has proven that going to bed and waking up at the same time every day helps your body's internal clock work better, and that stability even helps control your blood sugar. One of my patients, Helen, 64, used to drink coffee in the afternoons to stay awake, but she realized that habit kept her tossing and turning every night. When she swapped her coffee for a light evening walk, her sleep improved dramatically. She told me the next morning she felt more energized and clear-minded. Have you ever laid down at night with your mind racing through hundreds of thoughts? Try this. Before bed, write down 3 small things you're grateful for. Maybe a good meal, a kind word from a neighbor, or simply your grandchild's smile. That sense of gratitude calms the mind, and sleep comes more naturally. Sleep isn't just the end of the day. It's the beginning of a new one, filled with more energy. When you care for your sleep, you're giving your body the chance to heal, to renew itself, and to live healthier alongside the people you love. My friend, whenever I bring up the idea of writing down meals or blood sugar readings, many people sigh and say, "Doctor, I'm too old. I don't have the patience for that." But I always smile and reply, you don't need a thick notebook or complicated numbers. All you need is a small notebook and 1 minute a day for yourself. I remember Michael, age 69, who struggled a lot with blood sugar swings. When I suggested he jot down what he ate, his exercise, and his sugar levels, he gave it a try. At first, he wrote quickly, lunch, rice and fish, afternoon, walked 15 minutes. But after a few weeks, he noticed something. Every time he ate white bread, his blood sugar spiked. When he switched to whole grain bread, his levels stayed much steadier. That little health journal helped him discover his body's own patterns. Imagine this. Every evening before bed, you sit down for just a couple of minutes and write what you ate, if you walked, and how your sugar looked that day. Those little notes may seem small, but after a month, they paint a clear picture of your health. And when you bring that notebook to your doctor, they don't just see numbers, they see the story behind them. Have you ever wondered why your sugar is stable 1 week and unpredictable the next? That journal can give you the answer. It's not just writing. It's a way of reminding yourself that you're in charge, that you're listening to your body. So don't see it as a burden. See it as a gentle conversation between you and your health. Just 1 minute of writing each day gives you the power to live healthier, more confident, and more peaceful in your life after 60. You see, diabetes doesn't take your life away. It simply reminds you to love yourself a little more. If what I shared today gave you peace of mind, I'd be so grateful if you hit subscribe and turn on the notification bell. Every week, I'll be right here, like a friend by your side, bringing you simple, practical tips that can truly change your health for a lifetime. Let's keep walking this journey together, steady, strong, and full of meaning. Subscribe now, so you'll never feel alone in your fight for better health.